It's your boy Jay Shep. This time we're coming at you with a video for my health class. Basically, we're just going to be going around asking some students on campus what are some things that they're looking forward to seeing inside their own clinic. If they were to go to a clinic or a hospital or any sort of healthcare setting, what are some things that are important to them that'll make them keep coming back? Let's get to it. All right, so we're back in Kresge Library. So we're probably gonna hit up the 4th floor to see who we can ask. We're just gonna get the first question off rip. We're just gonna ask some people that are just some important safety policies that they hope to see in the clinic. Safety is a lot important to our people, whether it be, making sure that we're not violating HIPAA, making sure that, they feel safe and secure, making sure that the infections are under control, making sure that, we get the right patients, because sometimes you run into procedures or case studies that we have also studied in the class that kind of get people confused. So we just want to make sure that we get the right people involved. So I'll make sure that I'll come back and explain to you what's important to me. But first, we're going to ask the community what's important to them. Her name is Kaylee. So Kaylee, what are some important things, like we go to a doctor's office or to a clinic or to the hospital, what are some important things that are important to you?
I think finding the right medication and getting the right amount for my prescription and stuff, because I want to be able to take the right amount and stuff and not be over medicated or under medicated to solve the problem.
I agree. All right, we're gonna find more people. Thank you.
Thank you.
I appreciate it. All right, so we're on the 4th floor, the main floor, where everybody generally is. So we're just gonna go around and see who wants to be a part of it, and make sure we have the right people involved. So let's go. I think I got my first victim. Don't lie. My second person.
In the healthcare field, feeling comfortable with my physician, being able to talk to them.
Okay.
Sometimes people can come off very not rude, I don't know how to describe it, but you don't feel like you could speak to them comfortably, you know what I mean?
Like they talk down on you, something
yeah,
like that? Okay,
yes.
okay. All right, well I appreciate it. What's your name?
I'm Bella.
Bella, I'm Justin. Nice to meet you. All right, we're gonna find more people, all right? Do you have any? Just don't go to the doctor.
Yeah.
Well, I do not recommend that. Please go to the doctor if you need to see a doctor.
There's healthy remedies that can
holistic help that you can do and take part in. Yeah.
Doctors mess your body
I'm not talking about hippie herbal remedies, stuff like that. No, but just in general, there's ways that you can become healthier instead of just.
Okay. Well, see, we're getting it from both sides. We're getting it from the don't go to the doctor to go to the doctor, making sure you're getting the right medication and stuff like that. So we're gonna find more people, and we're just gonna ask different people what type of teamwork do they look for when they go to see a doctor. Let's get to it. All right, guys. So we're back with the second question. I'm here with Sika, and Sika, what team model would you want to see in a facility portrayed? So we have the multi-professional and the interprofessional and the trans-professional. By the way, she did look ahead of time to know the definitions and some examples to know the difference between the three.
I think personally, I resonated best with the interprofessional model.
Okay.
I mean, it just seemed like, in terms of my care, I would want multiple professions and doctors working together to get the best outcome.
Okay.
And if there's multiple disciplines and perspectives going into my care, I feel like I'm getting a well-rounded situation, and that's probably what I would want.
Okay. All right. So you heard it from the people. We got one person that's saying in the professional. So we're going to continue to ask in the community what type of team they want represented in their clinic. Okay. So we're just asking. All right. So guys, I got some more people. So I'm here with Jeff. Jeff, what type of teamwork are you looking for in a healthcare facility?
Probably a interprofessional one.
Okay.
I like when multiple people come together to try and come up with a reasoning.
Okay.
Figure out what's wrong with someone.
Okay. All right. Let me see that. And then here we have
Julian.
So
I think the interprofessional as well. I'm sorry.
No, it's good. It's all good. Keep going.
Okay. I think an interprofessional is good just because when you get advice from different medical professionals, despite their don't laugh, bro. Can I keep going?
Yeah, go ahead.
Okay, sorry. So I'm gonna redo it. I think interprofessional is good just because when you get different input from different medical professionals from all different types of fields, you sort of get a better knowledge, better understanding. Like your dermatologist and allergist example. That works out. It avoids any other medical complications, and I think it gives a better, broader answer.
All right.
Thank you so much.
You're hearing it from the people. We have 3 votes saying for interpersonal, 0 for multi-personal. So we're gonna keep going, asking the community what it is that they're looking for, what type of teamwork that they're looking for in their healthcare facility. Being really lame, didn't want to be a part of it, so we just moved all over to the OC. I'm here with Kenzie, and Kenzie, what are some important like safety things that you're looking to see? Like if you were to go to a doctor, urgent care, a hospital, what are some safety things that you're looking to see?
A couple of safety things I want to see. More security, I would say, like in the front. More background checks for the workers that are in those facilities. Yeah, more safety in your personal information. Yeah.
Okay. All right. So there we go. So
Is that good?
yeah, that's good. That's
Okay.
good. So there you have it. So we're having security, making sure that our charts are safe, making sure the background checks of the doctors, nurses, and any other staff that are working in the hospital. I'll be back with you guys to give my overview of what I want to see in my own clinic. Welcome back, guys. So we're here, just concluded our self-evaluation of going around asking everybody what is important to them to see in a healthcare setting, whether it be an urgent care, ER, physician's office, etc. And based off of what you guys heard, a lot of people have agreed with the interpersonal, on how they would want their teamwork, how they would want their doctors to work together and other sorts of clinical staff to work together. Stay tuned. I'm going to be doing my view of what I want to see at my own clinic. I just got the overview of what everybody else's want because I believe it's important to get a census of what the people want, especially when you're giving care to their own personal lives. It's important for us to understand and respect and value everybody's wishes, whether it be not sharing information to who it is they want information provided to. My God. I need my fucking gloves too. I'm gonna be up here. Ain't no fucking way. Alright guys, welcome back. So, it's freezing out here. This is Sunday, the day after, the day before we come back after Thanksgiving break. So, I'm just going to give you guys a little brief synopsis of like what I want to see in my own clinic, contrary to what everybody else was pretty much saying. So basically, the people that kind of want to have in my clinic was I wanted to have a doctor, a PA, a nurse practitioner, and at least one pharmacist like in the house at all times. And some patient safety controls that I wanted to see were some infection control, not like a wound clinic per se, more so of like being able to give advice to patients on how to take care of like infections and us being able to take care of infections in house as well. Medication safety, we have our own pharmacists to ensure proper dosing, and patient identification. Especially like in the hospital setting where I work at, to properly identify patients, there are four identifiers in which patients have to perform, make sure that their name, date of birth, last four of their social is correct, and sometimes like their address, we want to verify their address or if they stated a previous address. And so I believe that having those 4 things will help, prevent some teamwork. Everybody would be trained, whether there be, medical assistants or registrars, within the clinic, per se, the doctors will know how, everybody will be generally trained on how to conduct procedures, on if you need help with patients' cases, doctors, anybody would be gladly be able to come in and assist, at all levels. We're here want to make sure the environment is open, making sure that we're providing an environment that's not only conducive for people to actually learn, people to actually still be taken care of. Patient safety is assessed by using patients' charts. They will be stored at a billing center. I prefer to have them stored at the billing center because they all just happen at one particular location. So if I need to, look at how a patient needs to be billed, private insurance or state insurance wise, we can all have that at the medical billing center. And then as well, we'll also use paper charts in-house. I believe paper charts are I believe paper charts should be used more widely, just because of the fact it reduces the amount of errors. So what I mean by that is, now we're starting to see like high like terms of like hacking involved in terms of like our records being accessible, also being things being lost and things like that sort of nature. Whereas paper, we're writing down, making sure they're stored, with pen and paper the old-fashioned way, and we can kind of read basically, from read and correct the like any errors that may have happened at previous visits and whatnot. In terms of like the teamwork that I want to see involved, I want to see more of an interprofessional framework, just because it's more efficient by working together to streamline the process. Also, outcomes would improve as each person with expertise will provide a more holistic care. What is holistic care, you may ask? This is where we consider the patient's person, physical, mental, emotional, and social and spiritual well-being, more so rather than just being more focused on how do we treat the symptom per se. And it was kind of interesting to hear how everybody kind of chose the multi-professional approach, which talks about a group of people from different professions, groups or disciplines working together. Where an example could be where a nurse advising a doctor that some medications cannot mix, as they can produce a reaction, and therefore the doctor coming with a different plan. To me, I think if you have different specialties, coming together, looking more at like the holistic frame point, I believe that it'll provide a better care. Which is like here at OUWB, they are more of a holistic medicine type of approach, medical school. So they teach and emphasize that whole mind, body, spirit type of approach. Let's see, and some systems that I would like to see in place. The barcoding system, making sure that when you scan in a particular dosage for, let's say, epinephrine, when you scan that in, it'll make sure that the patient actually was prescribed this, from the doctor, whether it be in the clinic, making sure that the patient is getting what they actually came to get and actually what they're getting. Reducing the amount of handoffs. So as we saw with some of our case studies in class, when you have too many handoffs, happening, whatnot, it can lead to a lot of mental errors, errors in terms of where like, oh, I may know how Mr. Johnson may react to his chart may have reacted to this in the past, whereas, now I'm more so taking care of Mr. Willoughby, and I don't know how Mr. Willoughby may act, whereas somebody else may know how Mr. Willoughby act because they were his nurse or doctor beforehand. So I believe reducing the amount of handoffs, the barcoding system, make sure you're using computerized systems to prevent any entry of order for any lethal drug or require a weight-based dosing calculations. That's why I believe also in the beginning, it'd be important to get a height and accurate weight, because some medications are based on height and weight measurements. And I believe the controls are going to be adequate. Largely depends on how consistent and effectively they're being implemented. So I believe that if we don't take any shortcuts and making sure that we're doing this every single time for every patient, regardless of how long it takes, then I believe that this will be an effective approach to making sure that everybody's getting the proper care, proper treatment, and making sure that that we're making sure that we're producing the best results. And yeah, I hope you guys have really enjoyed this project. It's freezing out here, so please forgive me if I'm stuttering or whatnot. I can't hardly feel my lips right now, This is actually crazy how cold it is right now. And stay tuned for more videos coming up later. Bye.